Hi, I'm Bethany Armijo, and I have my husband John here with me today, and I'm going to be discussing gum disease. Most of us get up in the morning and we brush our teeth. Some of us may even go that extra mile and floss. But many of us aren't thinking about the health risks associated with keeping our mouths clean. According to the Centers for Disease Control, or the CDC, about 50% of Americans over the age of 30 have periodontal disease. Periodontal disease is the infection and inflammation or swelling of the gum tissue and the bone that supports our teeth. It is also known as gum disease. For the past 13 years, I've been working as a registered dental assistant in a dental office, and I have realized that many of our patients are uneducated as to what healthy mouths should look like. Today I will explain what gum disease is, including the warning signs and risk factors, how it can be prevented, as well as other health risks associated with it. Now let's start from the beginning. Gum disease starts with bacteria, and our mouth is full of bacteria. The bacteria in our mouth forms a sticky layer over our teeth called plaque. I like to refer to it as fur. You know, in the morning when you wake up and you have that furry feeling all over your teeth and you can't wait to brush them to get it off? That's plaque. Plaque must be removed from our teeth within 24 hours, or it hardens into a substance called tartar. Once tartar has set up residence on our teeth, the only way to remove it is to see a dental professional who will use sharp instruments to scrape it off. Gum disease has many stages, and I will discuss two of them with you today: gingivitis and periodontitis. The first stage of gum disease is gingivitis. Gingivitis means inflammation of the gums and occurs when tartar has irritated the gum tissue. According to the National Institute for Dental and Craniofacial Research, gingivitis is completely reversible, with daily brushing and flossing as well as regular visits to the dentist. The second stage of gum disease is called periodontitis. Periodontitis is the continued infection of the gums that has also led into the bone. The infection of the gums creates pockets, and in those pockets bacteria collects. When the bacteria collects in those pockets, it starts to infect the bone. Once the bone is infected, it starts to deteriorate. Once that bone is deteriorated, it is gone forever, and you will eventually lose your teeth. Now, I know this sounds like a lot of information, so I'm going to use an analogy that one of the hygienists I work with uses. Let's imagine we are able to take out that infected gum tissue from our mouths and lay it across our arms. What do we think it's going to look like? It's going to be about a 5 to 6 inch open, gaping wound that has pus and blood coming out of it. Now, I know that sounds pretty graphic, but it is a true picture of what's going on in our mouths if we have periodontitis. Now I'd like to discuss some of the risk factors and warning signs associated with gum disease. The CDC has put together a list of warning signs and risk factors. The warning signs for gum disease is bad breath or taste in our mouth that won't go away, red or swollen gums, sore gums, pain while chewing, loose teeth, and tooth sensitivity. It is suggested that if you have any of these warning signs, you seek dental treatment. Now, the CDC has also put together a list of risk factors associated with gum disease, and they include smoking, diabetes, poor brushing and flossing habits, stress, heredity, crooked teeth, immunodeficiencies such as AIDS, bad fillings, crowns, or ill-fitting partial dentures, dry mouth, and hormonal changes in females such as pregnancy. Now let's discuss the ways to prevent any phase of gum disease. Like we discussed before, plaque must be removed from our teeth within a 24-hour window. And the best method to remove that plaque is to brush and floss daily. Brushing your teeth with a super soft toothbrush is the most effective way at removing plaque. The next step would be to floss. We want to floss between those teeth to remove all of the food and plaque from between them. If flossing is skipped, you're allowing food and bacteria to stay inside your mouth and start to decay. You can think of it like a container of leftovers you have in your refrigerator, that one that you should have thrown out last week. Now, if you pull that out of your refrigerator and you opened it up, you would probably see and smell something that looked like an awful science experiment. That's what you're leaving in your mouth if you don't brush and floss at least twice a day. Not only do we need to worry about the health of our gums, we also should be aware of the health factors that are associated with gum disease. Recent research has shown that systemic diseases are linked to gum disease, such as in the article, Mouth, a Portal to the Body. Some of the diseases associated with gum disease include cardiovascular disease or heart disease, stroke, Alzheimer's disease, diabetes, and increased risk during pregnancy. Although research is still in its infancy stage, there is a consensus that the mouth and body are connected. Besides the health risks that are associated with gum disease, I'd like to leave you with one last fact. Gum disease is contagious. That means when you share a kiss with your significant other, you are also sharing their bacteria and possible infection. So let's recap all of the things that we've discussed today. Gum disease is an infection of the gum and bone supporting our teeth. There are risk factors that can increase your chances of having gum disease. Brushing and flossing twice a day is our best prevention method against gum disease. There are serious health conditions associated with gum disease. We need to remember gum disease is not always visible to us, but it is a contagious disease and it can have lasting effects on our overall health if left untreated. I'm going to leave you with a saying that my boss, Dr. Arnold Valdez, says, "You only have to brush the teeth you want to keep."